This is a reading of 5 Vagina Symptoms Decoded in the May 2018 issue of Health. Many below-the-belt changes are totally normal, but some are worth getting checked out ASAP. Find out how to tell the difference by Athea Levy. No two vaginas are exactly alike. Scent, discharge periods, they all vary from one woman to the next, which can make it a little tricky to decipher your down there symptoms. But when you notice a shift in what's normal for you, it could be a clue something's amiss, says gynecologist Alyssa Dweck, MD, author of The Complete A to Z for Your V. Any change that's causing you discomfort or lasts more than a few days shouldn't be ignored. Here, 5 signs it might be time to call your gynecologist. 1. You detect a funky new odor. Did you know your vagina has a microbiome just like your gut? Yep, it's home to a delicate balance of good and bad flora. Occasionally, though, the bad flora can get out of control, a condition known as bacterial vaginosis, BV. One of the telltale symptoms is a fishy aroma that's stronger than your vagina's usual scent, says Dr. Dweck. That's likely because the harmful bacteria produce ammonines, chemicals with a foul smell, she said. If this pungent odor persists, see your doc. A case of BV can be treated with RX medication. Left alone, it could raise your risk of STDs and pelvic inflammatory disease. Why do those bad microbes flourish in the first place? A new sex partner could do it. Reason number 376 to use a condom, as well as anything that causes irritation like scented tampons. Number 2, your vagina itches like mad. When all you want to do is scratch, it's tempting to make a beeline for the pharmacy to pick up an OTC yeast infection cream. But self-treating an itchy vulva or vagina is risky, says Michael Kakovic, MD, an OBGYN at Ohio State University Wexner Medical Center. An overgrowth of yeast isn't the only potential culprit, and using the wrong medication could lead to even more inflammation and irritation. Oi! See your doctor to find out what's causing the symptom first, says Dr. Kakovic. A few possibilities: synthetic fabrics, a new product, menopause, and trichomoniasis, an STD caused by microscopic parasite. Now that sounds frightening, but before you freak, know that it's very common. Most people never have any symptoms and very curable, usually with a single dose of an antibiotic. 3, your period is wonky. Lots of normal things, including stress and even jet lag, can mess with your menstrual cycle. When your period has been irregular for 6 months, however, it's a good idea to check with your doctor, says Daniel M. Breitkopf, MD, chair of the Division of Gynecology at the Mayo Clinic. The cause could be totally benign, starting a new type of birth control, for example, or it could be a symptom of another issue like a thyroid disorder or polycystic ovary syndrome, PCOS, a hormonal imbalance that interferes with ovulation. If that's the case, your MD may prescribe the pill to help you manage your symptoms. 4, your discharge looks odd. You're familiar with the slippery egg white-like secretions around the time you ovulate, but any other significant change in the amount, color, or consistency could signal an issue. Yeast is often accompanied by thick white discharge, while BV discharge is typically thin, gray, and smelly, says Dr. Dweck. Notice a big increase in secretions? That could be a sign that an object like a tampon or a condom is stuck inside the vagina. You'll likely detect a foul odor too. Another concern with unusual discharge is chlamydia, so it's worth mentioning to your doc. But remember that in general, discharge helps keep things down there in working order. There's no need to worry unless you note a sudden change. 5, there's a lump on your labia. On each side of the vaginal opening, there's a small organ called Bartholin's gland, which lubricates the vulva. If either gland becomes blocked, fluid can build up, forming a cyst. In some cases, a cyst may go away on its own, but if the bump starts to hurt or grows larger, get it checked out, says Dr. Drick. Discomfort can be a sign that it's infected and may need to be drained. For immediate relief, soak in a warm bath without any soap or bubbles. Things you should never do to your vagina. 1, insert a jade egg. Some people claim that walking around with a stone in your vagina can boost your sex life and strengthen your pelvic floor. Aside from the risk of pain and infection, jade isn't exactly sterile. Clenching for hours doesn't make sense. Contracting constantly is like doing half a bicep curl and not finishing it. That's not how you work a muscle, says Jen Gunter, MD, a San Francisco OBGYN. Stick with Kegels. 2, steam it. No, sitting over a bowl of herb-infused hot water won't cleanse your uterus, as proponents claim, and it doesn't need cleansing anyway. Plus, You could end up with a second-degree burn. Yikes! 3, treat it with garlic. Placing a clove inside one's vagina is a popular folk remedy for yeast infections, but in the words of Lauren Stretcher, MD, Associate Clinical Professor of Obstetrics and Gynecology at Northwestern University, it's ridiculous. She guesses some women turn to it after an OTC cream has failed to offer relief. They may just need a prescription, she said, or have an entirely different issue. This reading of 5 Vagina Symptoms Decoded is brought to you by Women's First OBGYN in the Hampton Roads, Chesapeake area, your premier health and aesthetic center. We offer all gynecology services, and we're welcoming new patients. We also offer vaginal rejuvenation for women who are experiencing vaginal looseness, vaginal dryness, or the inability to hold pee. This could be due to menopause, hormonal changes, or a variety of issues. Call today for your vaginal rejuvenation consultation appointment.